Hi, good morning, David. My name is Mahira. I'm your invigilator for the OIT speaking session on the 6th of August 2021. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is David Cross.
And what is your candidate number, please?
My candidate number is 231089228.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
All right. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
Where do you see yourself in 5 years?
In 5 years, I hope to continue offering quality nursing care. I expect to be more skilled and experienced in the field. Moreover, I intend to pursue a short course in management. That way, I will be able to handle managerial and administrative duties.
What is your greatest weakness as a clinic nurse?
When I started practicing as a nurse, I used to get overly involved with patients under my care. As a nurse who is passionate about caring for patients, I couldn't watch them suffer. But after realizing it and discovering it was interfering with my service, I learned to make patients comfortable without compromising my duties.
Describe your interactions with other nurses and doctors.
I work effectively when I'm part of a team. I am easy to work with and not burdensome or too demanding. Besides, I maintain professionalism when working with others.
What is most challenging about being a clinic nurse?
I find it very tough to see a patient suffer. At times, patients come with excruciating conditions. Other times, the kind of procedures they undergo are very painful. But as a nurse, I always remain positive that they will get over the suffering. Besides, I offer the best care possible to make them comfortable and perhaps ease their pain.
What do you do when a patient is unsatisfied with your care?
I listen to the patient to understand their complaint and then try to resolve it. Besides, I continue to offer nursing care with professionalism and courtesy. If the complaint or matter at hand is beyond my ability, I report to the relevant office for action. If a patient makes unreasonable demands, I remain firm and let them know the boundaries of my job.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your OIT speaking role play. Don't worry if I stop you when the time is up.
Hello, good morning. My name is David Cross, one of the nurses working in this clinic. How may I help you today?
Good morning, David. My daughter recently had a heavy nosebleed. I didn't really know what to do. So I would like to get some advice, in case it happens again.
I'm sorry to hear that. Your daughter had a severe nosebleed. Definitely, I can help you in this situation. Well, before proceeding, how may I address you?
You can call me Mahira.
Mahira, may I know your daughter's name and age, please?
Sure, her name is Megan, and she is 7 years old.
All right. For my better understanding, could you please explain in detail about Megan's nosebleed?
It was a terrifying incident, nurse. There was a lot of blood. She bled about 250 milliliters, nearly a cup of blood. And it lasted about 10 minutes. I was completely lost, and what I did was, I kept her sitting leaning back, until the bleeding stopped.
That is a whole lot of blood. I can imagine how difficult it was for you and your daughter. Anyway, Mahira, I would like to get some relevant details related to her nose bleeding.
Well, nurse, my daughter hasn't had any nosebleeds or injuries to her nose before. This is the first time it happened, and I can't figure out any particular issues.
It's okay, Mahira. What about her general health?
She's healthy, nurse. And she doesn't have any other problems.
That is good to hear. Is she taking any medication?
No, she is not taking any medication.
Thank you for your information. First of all, Mahira, in a panic situation, you make Megan sit leaning back until the bleeding stops, which is highly risky. It is strictly recommended not to sit leaning back in such situations, because there is a risk of choking on blood and causing suffocation.
Oh my God. I was really unaware of this.
Yes, Mahira, I can understand that. Now, I will explain some methods to stop nosebleeds. Instead of leaning back, you should make her lean forward, with her head tilted forward, to avoid the above-mentioned risk. Afterwards, you can pinch the nose above the nostrils for 10 to 15 minutes. In addition, you can apply an ice pack to the top of the nose.
Definitely, nurse. I will follow this advice, if it happens again. The nosebleed was really heavy, so I got nervous. And I didn't know whether or not I should take her to the doctor.
It is quite natural, Mahira. I can imagine the situation well. For your understanding, I can advise you when medical attention is needed in such a situation. If the duration of bleeding is longer than 15 minutes, or if there is excessive blood loss, it is an emergency situation that requires medical attention. Moreover, visit the doctor for nosebleeds following trauma, and Mahira, if the nosebleeds are persistent, seek medical attention.
All right, nurse, I will pay attention to such situations.
Beyond this, let me give some information about nosebleeds in children. There is a chance for regular occurrence in 50% of children aged between 6 to 15 years, which is usually caused by picking or blowing the nose too hard. Also, the dryness in the nose can cause bleeding.
Actually, nurse, Megan said her nose feels sore and dry. So, maybe that caused the nosebleed. Isn't it?
Yes, Mahira, probably that will be the reason behind your daughter's nosebleed. If that is the case, I can suggest some remedies to try.
That will be of great help, nurse.
All right. Try the use of the saline nasal spray. It will help in the reduction of dryness, irritation, soreness, etc. Mostly, this will help to avoid the further occurrence of nosebleeds, if those are the reasons.
Thank you for such a great explanation. I feel much better prepared to deal with a nosebleed. Certainly, I will get a nasal spray for my daughter.
Good to hear that, and thank you for your kind words. Mahira, always feel free for further queries. I wish your daughter a healthy life ahead.
Thank you. That is the end of your OIT speaking role play. All the best.
Thank you.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.